Lara was in her 30s, very attractive and energetic. She was working in a MNC and she often dressed very attractively. She was very disorganized, often leaving to the last minute tasks that require considerable planning. Lara made promises to other people that were impossible to keep, but seemed to be aimed at winning their approval. When she broke the promise, she usually made up a story designed to elicit sympathy and compassion. Her boyfriends changed almost weekly, but her enthusiasm and optimism about the future remained high for each of the time. She lost her job because of her disorganization. After a rather long period of depression, Lara sought help from a psychologist who diagnosed her with histrionic personality disorder. So, what is personality disorder? Personality is the way of thinking, feeling, and behaving that makes a person different from other people. An individual's personality is influenced by experiences, environment, and inherited characteristics. A person's personality typically stays the same over time. A personality disorder is a way of thinking, feeling, and behaving that deviates from the expectations of the culture, causes distress or problems functioning, and lasts over time. Types. Cluster A personality disorders. It involves unusual and eccentric thinking or behaviors. Paranoid personality disorder. The main feature of this condition is paranoia, which is a relentless mistrust and suspicion of others without adequate reason for suspicion. People with paranoid personality disorder often believe others are trying to demean, harm, or threaten them. Schizoid personality disorder. This condition is marked by a consistent pattern of detachment from and general disinterest in interpersonal relationships. People with schizoid personality disorder have a limited range of emotions when interacting with others. Schizotypal personality disorder. People with this condition display a consistent pattern of intense discomfort with and limited need for close relationships. Relationships may be hindered by their distorted views of reality, superstitions, and unusual behaviors. Cluster B personality disorders. It involves dramatic and erratic behaviors. People with this type of conditions display intense, unstable emotions and impulsive behaviors. This includes antisocial personality behavior. People with this disorder show a lack of respect towards others and don't follow socially accepted norms or rules. And they may break the law or cause physical or emotional harm to others around them. They may refuse to take responsibility for their behavior and display disregard for the negative consequences of their actions. Borderline personality disorder. This condition is marked by difficulty with emotional regulation, resulting in low self-esteem, mood swings, impulsive behaviors, and subsequent relationship difficulties. Histrionic personality disorder. This condition is marked by intense, unstable emotions and a distorted self-image. People with histrionic personality disorder, their self-esteem depends on the approval of others and doesn't come from a true feeling of self-worth. They have an overwhelming desire to be noticed by others and may display dramatic or inappropriate behavior to get attention. Narcissistic personality disorder. This condition involves a consistent pattern of perceived superiority and grandiosity. an excessive need for praise and admiration, and a lack of empathy for others. These thoughts and behaviors often stem from low self-esteem and lack of self-confidence. Next is Cluster C personality disorder. It involves severe anxiety and fear. Avoidant personality disorder. People with this condition have chronic feelings of inadequacy and are highly sensitive to being negatively judged by others. Though they would like to interact with others, they tend to avoid social interaction due to the intense fear of being rejected. Dependent personality disorder. This condition is marked by a constant and excessive need to be cared for by someone else. It also involves submissiveness, a need for constant reassurance, and the inability to make decisions. People with dependent personality disorder often become very close to another person and spend great effort trying to please that person. They tend to display passive and clinging behavior and have a fear of separation. Obsessive compulsive personality disorder. This condition is marked by a consistent and extreme need for orderliness, perfectionism, and control that ultimately slows or interferes with completing a task. It can also interfere with relationships. This is a separate condition from obsessive compulsive disorder. Obsessive compulsive disorder is an anxiety disorder, and people usually are aware that OCD is causing their behavior and accept they need to change. But the people with obsessive compulsive personality disorder usually have little, if any, self-awareness of their behaviors. Symptoms. Issues with self-esteem. To have very high or low self-esteem or fluctuates. Inconsistent values. For example, you might behave appropriately at work but act differently at home. Problems maintaining close relationships. Your behavior may frustrate others and make them less likely to want to spend time around you. Difficulty with empathy. You may come across as insensitive or uncaring. Some people may resort to lying regardless of how it affects others. Trouble with boundaries. People with personality disorder may also refuse or find it hard to establish and recognize boundaries with others. Problematic parenting styles. Some parents with personality disorder may have abusive or irresponsible parenting styles, and some may be too involved in their children's lives, overly emotional and too enmeshed in family relationship. And others may be extremely detached and uninvolved in their child's lives. Difficulty regulating emotions. People may get angry easily or be quick to react in frustration when something isn't going their way. Problems with stress. Try to cope with stress in unhealthy ways. Low self-awareness. Cannot recognize or acknowledge they have a mental health condition and refuses to seek treatment, and also blame other people for their behavior or problems. Difficulty at work. Make it tough to perform in a professional work setting and may find it hard to work on a team. Causes. Personality disorder are among the least understood mental health conditions. Following factors may contribute to the development of personality disorders. Genetic. Scientists have identified a malfunctioning gene that may be a factor in obsessive compulsive personality disorder. Researchers are also exploring genetic link to aggression, anxiety, and fear, which are traits that can play a role in personality disorders. Brain changes. Findings in studies on paranoid personality disorder points that altered amygdala functioning. The amygdala is the part of your brain that is involved with processing fearful and threatening stimuli. In a study on schizotypal personality disorder, researchers found a volumetric decrease in the frontal lobe of their brain. Childhood trauma. People with borderline personality disorder, for example, had especially high rates of childhood sexual trauma. People with borderline and antisocial personality disorder have issues with intimacy and trust, both of which may be related to childhood abuse and trauma. Verbal abuse. In one study, people who experienced verbal abuse as children were 3 times as likely to have borderline, narcissistic, obsessive compulsive, or paranoid personality disorders in adulthood. Cultural factors. This may also play a role in the development of personality disorders. For example, there are remarkably low cases of antisocial personality disorders in Taiwan, China, and Japan, along with significantly higher rates of cluster C personality disorders. Diagnosis. Physical exam. The doctor may do a physical exam and ask in-depth questions about your health. In some cases, your symptoms may be linked to an underlying physical health problem. Your evaluation may include lab tests and a screening test for alcohol and drugs. Psychiatric evaluation. This includes a discussion about your thoughts, feelings, and behavior and may include a questionnaire to help pinpoint a diagnosis. With your permission, information from family members or others may be helpful. The use of diagnostic criteria in DSM-5. The doctor may compare your symptoms to the criteria in the DSM-5. Generally, the diagnosis of a personality disorder includes long-term marked deviation from cultural expectations that leads to significant distress or impairment in at least 2 of the following areas: the way you perceive, emotional responses, dealing with other people, and control of your impulses. Management. Psychotherapy. The main goal of psychotherapy include reducing anxiety and depression, helping the person understand that their problems are internal and not caused by other people or situations, decreasing unhealthy and socially undesirable behavior, modifying the personality traits that are causing difficulties, etc. The commonly used type of psychotherapy include psychoanalytic or psychodynamic therapy, dialectical behavior therapy, cognitive therapy, group therapy, psychoeducation, that is, teaching the individual and family member about the illness, treatment, and ways of coping. Medication. There are no medications specifically to treat personality disorders. However, medications such as antidepressants, anti-anxiety medications, or mood stabilizers or antipsychotic drugs may be helpful in treating some symptoms. Team approach. More severe or long-lasting symptoms may require a team approach involving a primary care doctor, a psychiatrist, a psychologist, social worker, and family members. Self-care and coping strategies. Learn about the condition. Knowledge and understanding can help empower and motivate. Get active. Physical activity and exercise can help manage many symptoms such as depression, stress, and anxiety. Avoiding drugs and alcohol. Alcohol and illegal drugs can worsen the symptoms or may interact with the medications. Get routine medical care. Don't neglect checkups or regular care from the family doctor. Join a support group of others with personality disorder. Write a journal to express your emotions. Try relaxation and stress management techniques such as yoga and meditation. Stay connected with family and friends and avoid being isolated. Hope you like this video on personality disorders. Please subscribe the channel. Thank you for watching. Keep smiling.